Okay, so look, we've covered smoking and nutrition, and now I'd like to talk about something that I discuss with all of my pregnant patients, and that's alcohol. How much would you say you drink?
Well, I drank a bit before I found out I was pregnant, but just wine with dinner.
Okay, has that changed since you found out you were pregnant?
Not really, but I've never been a big drinker.
Okay, just so I've got a better idea of what your drinking patterns are like, how often would you say you drink?
3 or 4 nights a week, wine with dinner.
And how much would you have? What I'm going to do is I'm going to show you here a chart of what a standard drink is.
Well, I usually drink wine, so I guess about a bottle between us.
Between you and your husband. Okay. Would you share it equally? Would one of you drink more?
Yeah, no, I drink less than my husband. I don't really want to drink much at the moment, but I just find it helps me relax.
Okay. What have you heard about alcohol and pregnancy?
Everything in moderation. I know that I've heard that you're not supposed to go and get wasted, and I'm definitely not doing that. It's just a glass or 2 with dinner. And I drank during my pregnancy with Tim, so I'm not overly worried about it.
Look, moderation is good for most things, but when you're pregnant, it's safest not to have any alcohol at all.
No alcohol at all. But I drank when I was pregnant with Tim and he's fine.
Look, I'm sure he is, but when you were pregnant with Tim, it was 4 years ago. The guidelines have since changed. There's actually no safe level of alcohol when you're pregnant. And also, every pregnancy is different. So what might have been okay in your first pregnancy may not be so okay now.
Are you saying that I've hurt my baby? Because I've been drinking as I normally would. If it's so bad, then why hasn't someone told me sooner?
I'm not saying that you've hurt your baby. No one's suggesting that, and I'm really sorry that no one has been clear with you beforehand. But the important thing is that now that you're aware that you stop drinking any alcohol, that you look after your health, that you maintain your nutrition, reduce your stress and relax, all the decisions that you make from now on are going to be really important for your health and the health of your baby.
Well, that's going to be really hard because a glass of wine, it helps me relax.
You've mentioned relaxing a few times. Is there something that's causing you to feel not relaxed?
Well, it would be great if my husband helped out more, came home earlier, helped put Tim to bed, maybe if he gave up drinking too.
Do you think that's something he'd be willing to do?
I don't know, but we can chat about it. So what do I say to those people who say that a glass of wine on occasion is no big deal?
Is it going to be hard for you to be around those people?
Yes, because my friends, they just say doctors, they tell you that to make you feel guilty. I don't know what to say to that.
Look, I can understand. In those situations, it's probably best just to say that there are new guidelines, you want to do what's healthiest for your baby, and you want to give your baby and yourself the best start. How does that sound?
Yeah, that sounds okay. I can try it.
Okay, good. Now, look, I'm going to give you some information that will explain the reasoning behind these new guidelines and also some tips that might make you feel more confident about stopping drinking. Don't forget that anytime you can come back in and discuss it and perhaps bring your husband as well, and we can go through all of this together.
Yeah, that might be really helpful.
Great.
I'll think about that.
It's important to open with a question, like what do you know about or how do you feel about drinking alcohol in pregnancy? These open questions allow the woman the opportunity to talk about her knowledge and feelings. It also allows the health professional to know where to guide the conversation in terms of advice. Rather than tell the woman the health consequences of alcohol consumption, this approach, known as motivational interviewing, aims to find out the patient's level of knowledge and provide the relevant information. There is no assumption that if she just had the correct information, she would change. So it's good to make some general statements, such as, a lot of women receive mixed messages about alcohol and pregnancy. This helps the woman realise that they're not alone and that it's completely normal for a health professional to bring up alcohol.